So I wanted to thank everybody for sending us different topics that they had interest in, because this does help me in regards to picking out some topics to talk about. So that is going to be my focus for the next couple Dr. Nichols 2 cents. So the one I'm going to talk about today is the best way to deal with postmenopausal symptoms through nutrition. And my patient actually sent this to me as a topic, and I'm kind of thinking to myself, she shouldn't have any symptoms of menopausal stuff because she should be taken care of, but maybe she's just looking for a little bit of information for her friends. So this is for you, my friend. So when we look at hormonal change, there are environmental factors that also can play a role in our hormone production. So as we age, our estrogen progesterone ratios change, and that's about, in our mid-30s. But there are environmental things that also can increase estrogen and also decrease progesterone. And so I want to talk to you a little bit about histamine. So histamine is actually a neurotransmitter. So that means that histamine is involved in brain chemistry. And the body makes histamine, although too much histamine can be detrimental. Not enough histamine can also be detrimental as well. So we think of histamine as allergies, but that is only a piece of what histamine contributes to. So we have 4 different histamine receptors in the body, and they all do something different when histamine binds to them. When women go through their hormonal change, yes, progesterone and estrogen levels start to decline, but there is still too much estrogen in relativity to progesterone. And if somebody has high histamine and they can't break down excess histamine, histamine also contributes to estrogen issues, and high estrogen can also contribute to increasing histamine. So when histamine is high, you can have vasodilation, hot flashes, night sweats. You can have insomnia. You can have vaginal dryness. You can have weird rashes. And not only, so you'll see symptoms that come and go depending on how much histamine you've been in contact with for the day. So the body makes histamine, hormones play a role, stress plays a role, but also food. So when you look at dealing with some of these symptoms through nutrition, you need to look at if you were eating foods that are high in histamine. And so foods that are high in histamine could be healthy food. Now, foods that are high in histamine are gluten, dairy, but then avocados, citrus, strawberries, all your fermented foods, so sauerkraut, vinegar, all alcohol, all tea. And so if you're eating these foods, for health benefit, for instance, a lot of your fermented foods, that can increase histamine. And if you don't produce enough of an enzyme called diamine oxidase to break down that histamine, you can get hot flashes, night sweats, weight gain. And so when you're looking at using nutrition for some of your postmenopausal symptoms, you really want to focus on nutrient-dense, antihistamine, anti-inflammatory foods. And, that's going to be a lot of your cruciferous vegetables. Kale, spinach is actually high in histamine, so you would want to avoid that. And, really focusing on balancing out estrogen to progesterone ratio. And, sometimes, believe it or not, taking antihistamines can also help with some of the symptoms of postmenopause through, if you have high histamine. So look at histamine and postmenopausal symptoms. And there are a lot of information out there in regards to foods that are high in histamine. And, jot down foods that, that when you eat them, you get a hot flash, or you get a night sweat, or you get insomnia. And then see if that's high in histamine. And if it is, and you're having those symptoms, then you have too much histamine. So I guess we're not looking at histamine in regards to the itchy scratchies. We're looking at histamine in regards to the hot flashes and night sweats. So watch your food, see what happens, and you might have to do some food avoidance. All right? Till next time, that's my 2 cents.